Hello, I'm Jennifer Moisey, and I'm the Global Medical Franchise Lead of Bacterial Pipeline Vaccines at Pfizer. Clostridioides difficile, or C. difficile, is a bacterium or germ that can cause a serious and potentially life-threatening infection associated with symptoms from diarrhea to severe intestinal inflammation. Despite recent progress in intervention, C. difficile infection afflicts hundreds of thousands of people across the U.S. and Europe and remains a widespread and potentially fatal disease that can be debilitating. Pfizer, along with a group of experts representing a cross-section of healthcare professionals and patient organizations impacted by this public health threat, launched a C. difficile awareness initiative to raise awareness of the potential risks for and impact of the infection. They continue to encourage collaboration across organizations to address and help combat this serious and sometimes deadly disease. As part of this effort, I'm here today with Dr. Erik Dubberke, a professor of medicine at Washington University. Dr. Dubberke is a leading infectious disease expert and member of the C. difficile Awareness Initiative and is joining us to talk about C. difficile. I'll let him introduce himself and tell you about what he's working on.
Thank you very much, Jennifer. Well, I'm an infectious diseases physician, and my main focus of research is C. difficile, and I'd like to provide a little background in how I became interested in C. difficile. So when I was in my training to be both an internist and then an infectious diseases physician, I actually found C. diff to be very frustrating. There was no one standard approach. Some things seemed to maybe work, some things seemed to maybe not work, but it was really not clear what was going on since everyone was kind of doing their own thing. So I took it upon myself to review the literature and the background on C. diff and what people were doing, and I actually found that the source of my frustration was because there was really very poor quality of evidence for much of what we were doing at the time. And so that's how I became interested in C. diff, and that's been the focus of my research since I finished my training. And with my research, we look to improve our understanding of who is at risk for C. diff, how to best diagnose it and treat it, and I think most importantly, how to prevent it from happening in the first place.
Thanks for joining today, Dr. Dubberke. As an infectious disease expert, why do you think it's important to raise awareness about C. difficile infection?
Yeah, C. diff has actually been recognized as the complication of antibiotic treatment going back now about 40 to 50 years. And despite that long history, there continues to be a lack of awareness, mostly within the public, but I'd still say within the medical community. A lot of our current knowledge of C. diff and how to best manage it sometimes is still lacking. Although there is another important public health threat going on right now, it is important to continue the conversation with C. diff as it is an urgent threat. People are still getting it, and we still need to improve awareness and knowledge and how to best diagnose, treat, and prevent it.
Is there a relationship between C. difficile and COVID-19? Could contracting one disease make patients more vulnerable to getting the other?
We're still learning about the interaction between C. diff and COVID-19. There are similarities between the two as well. The risk factors for having COVID-19 and C. diff are similar in older people with comorbidities are at increased risk for both of them and complications for both of them. And there's some overlap in symptoms, and this can be confusing just both from a diagnosis standpoint and a management standpoint. So the main symptom of C. diff is diarrhea, and that can be a symptom of COVID-19 as well. And there may be some overlap when it comes to risk factors and prevention. And the main risk factor for C. diff infection is antibiotics. Many patients that are hospitalized with COVID-19 end up on antibiotics. So from that standpoint, you would think patients with COVID-19 might be at increased risk for C. diff infection. On the flip side, one of the main ways we prevent C. diff in the hospital is to prevent its spread from person to person. And many of those measures we use to do that in the hospital are also the same measures we use to prevent COVID-19 spread in the hospital. And so healthcare workers are under caring for patients with COVID-19. They're very fastidious when they're adhering to those precautions, so that actually may decrease risk for C. diff infection, because by decreasing transmission of COVID-19, they're going to be decreasing transmission of C. difficile. So it remains to be seen exactly how COVID-19 is going to impact C. diff infection, but it's important that we continue to recognize the overlap and do our best to differentiate between the two.
Thank you, Dr. Dubberke, for sharing those insights into C. difficile. Join us next week when I talk to Millicent Gorham of the National Black Nurses Association and Christian John Lillis of the Peggy Lillis Foundation to discuss what it's like caring for the C. difficile patient up close and personal. Tune in on any podcast streaming app to hear more.